In this video, we're going to take a look at some of our flexibility breakouts that we're going to use to target the hip flexor group or to target hip extension, to build motion into hip extension. Now, these are typically done with lunge type of stretches because the idea here is we're trying to get the leg and the thigh specifically back behind the body. And these can be really effective stretches, but they're also stretches that tend to be done very improperly, with very poor form, and in ways that just really don't target this motion and this muscle group the way we need to. So we need to be really picky with form here. And to understand this, I think the really key point here is we need to remember that hip extension is a relative motion. And what we mean by that is hip extension, when we're talking about this, we're referring to a motion where the thigh is rotating backwards relative to the pelvis. We want that motion to occur from the hip joint itself. However, when we're doing these lunge stretches, what's going to typically happen is that if this muscle, this hip flexor muscle group is tight, as we go into a lunge position, as this thigh tends to rotate backwards into extension, it's going to create tension of that hip flexor muscle group. But if we're not careful, that tension in the hip flexor muscle group will transfer the motion to the pelvis and the lumbar spine. So instead of creating a pure hip extension, we're going to end up creating an anterior tilt and an extension through the spine, which is not only going to be less effective for targeting the hip itself, but a lot of times we're going to be using this stretch with lower back pain patients. And so this can actually be detrimental as it transfers the force and transfer the motion to the lumbar spine itself. So one of the really key things with doing this stretch is to avoid that anterior tilt and that lumbar extension. So what we're going to do is essentially superimpose a posterior tilt in this stretch so that we stabilize the lumbar spine and really help to target the motion at the hip joint itself. So with that said, let's go over the two basic stretches that we're going to use when we need to target hip extension. And these are going to be our kneeling lunge hip extension stretch and also our standing lunge hip extension stretch. So let's take a look at each of these. All right, so this is going to be our kneeling lunge hip extension stretch. So what we're going to do here is just begin from a kneeling position, and we can certainly hold on to a wall or a chair, or as I'm doing here, some balance sticks for support. And what I want to do is just have my leg just right underneath my body, and I want this lead leg out in front of me. But what we're going to find is it's going to be much easier, as we'll see in a moment, to get our foot farther and farther forward. This provides a little bit of a wider base of support, but it's also going to allow us to more easily lunge forward to create the stretch. Now, the other key thing to keep in mind here is when we're starting this, we need to make sure we're not already starting in an extended hip position. So a lot of people will want to get down into this position and they're going to kind of be forward. And what's happening here is I've already created tension through this hip flexor group and I'm not going to have anywhere to go. So we need to start by backing off just a little bit, almost like so that tension is off the hip itself. Now, as I mentioned at the start of the video, the key here is as we go forward, we want to prevent that pelvis from tipping forward. We don't want that pelvis to go anterior, so that creates that extension through the spine. We need to keep the motion focused at the hip. So to help with this, what I'm going to do is from the starting position, I'm going to perform a posterior tilt. This is going to stabilize through the spine, and it's going to create a little bit of a tension to start already on this hip flexor group. Now from here, I'm holding that tilt and I'm holding that tension. And what I'm going to do is I'm going to lunge forward. To do this, it is much more effective to think about your lead knee here is going to just pull you forward. And as I pull forward, I'm holding that tilt. I'm staying tall. The other thing I want to prevent is I don't want the trunk to lean forward. Again, this gives us that kind of false sense of I'm getting farther forward, but the motion is actually coming from a tilt as opposed to an extension through the hip itself. So again, we're going to stay tall while we're holding that pelvic tilt. So what this looks like is from this starting position, I've not created that extension through the hip yet. I've cut it loose. I can then perform a posterior tilt. As I do this, I'm already going to feel a light little stretch into the front of my hip, but it should be very comfortable for the lower back. From this position, I'm holding that, I'm staying tall, and I'm letting that knee drive forward just to pull my body forward. And because of the way the joint works, and because of that pre-stretch I've created in through that front of the hip, what I should find is I don't need to go very far in order to get that effect. I should just feel a stretch on the front side of the hip, even into the upper thigh just a little bit, but it should be a nice comfortable stretch. Now I'm typically going to hold this stretch for 30 seconds, and I'm going to typically perform 3 repetitions of that stretch. Although keep in mind there's nothing wrong, and sometimes there can be some advantage to holding longer or even doing more repetitions. So again, just to quickly review. Tall and upright, but I'm making sure that hip is not in that extended position. To start, foot is farther in front of me, so the foot is farther forward than my knee. I'm going to perform that posterior tilt to stabilize the spine and create some pre-stretch or preload through the hip flexor group. Staying tall, holding that pelvic tilt position. I'm going to lunge forward. My knee is going to slide forward to pull my body forward. That is going to deepen the stretch on the hip flexor group. Holding 30 seconds or more as needed. Come on back. Take the tension off the hip. All right, so now we're going to take a look at our standing lunge hip extension stretch. Now this is going to be similar to the kneeling lunge stretch, but of course now we're standing instead of kneeling. Now, one of the big advantages and why I like this when possible is that this really gets to the one joint hip flexor group itself. We're not worrying about creating some tension or bend through the knee itself, so it takes a little bit of the pressure off the quadriceps and focuses it, like I said, really onto the joint itself and into that one joint hip flexor group. The other advantage is this tends to be a little bit more functional. And what I mean by that is when we are typically worried about the hip not extending properly, it's going to be things like running and walking. So this standing position really is closer or mimics closer how that joint and how the posture needs to be when the hip needs to extend with these activities. So what we're going to do here is, again, I'm using my sticks here. We could use a wall for support as needed, but I'm going to start just from a standing position. And I find this typically works much better when we can get our foot up on something. Now, it doesn't necessarily need to be as high as the box I'm using here. Sometimes even just doing this in a staircase with your foot up on the first or second stair works very well, or up on a chair. But it does tend to work much better with your foot up on something as opposed to from this standing position. It's not that it can't be done by this position, but when we're in the standing position, it tends to, as we lunge forward, create more of a tendency to lean forward because it lowers our body a little bit more. And that's going to take a lot of the focus and the direct effect away from the hip itself. So, like I said, we're going to start standing and we're just going to get our foot up on something. Now, form is going to be really important here. And again, as I mentioned in the previous video, one of the things that almost everybody is going to do initially is that they're standing, and when they go to put their foot up on something, they're going to start from this already forward position. And again, what this is doing here is I'm already creating extension and taking the slack up through the hip. Now, from this position, I don't have anywhere to go with it. So it's really important that we keep the hip in a neutral position to initiate the starting position. So if I'm just standing, my leg is just completely underneath and in line with my trunk. So from here, I'm not going to lunge forward, but I'm going to get my foot up. And this helps to keep that leg and hip in a more neutral starting position. Again, as we discussed with our kneeling lunge, the key here is to isolate and create the motion at the hip itself. So again, from here, I'm going to create that posterior tilt to stabilize my spine and pelvis. And then from here, again, just as we talked about with our kneeling lunge, I'm going to drive the motion with this kind of forward leg. So from here, I'm going to let the leg go forward to pull me forward. I'm staying tall, holding that pelvic tilt as we just discussed, and I'm keeping the shoulders nice and tall. Shoulders stay stacked over the hip. So your body is moving, upper body is moving forward as a unit, trying to really prevent that forward tilt or that extension through the lumbar spine. So again, let's go over it from the beginning. Nice, loose, relaxed standing position. Leg is directly underneath me. I'm going to get my opposite leg up on a box or a chair or a stair. But as I do so, I am not leaning forward. I am keeping that keeping that leg right underneath my trunk, hip in a neutral position. I'm going to perform a posterior tilt, creating tension or initiating tension through the hip flexor group. And from here, I'm going to simply pull my body forward by my leg in front of me. My knee in front of me is just pulling forward. Knee kind of goes closer over the foot. And this creates that forward translation, but my leg is staying behind me. I'm really trying to keep that stuff tall, and I'm trying to keep that stretch right into that front of that group. Again, typically we would perform this for 30 plus seconds and repeat 3 repetitions, usually on each side. Now, just 1 or 2 more other points to keep in mind. So as we said, oftentimes that starting from that already lunged position is a really common fault. The other couple really common faults that we want to look out for is when we do this, we want to make sure we're square. And what I mean by that is if I'm facing forward, I kind of want my feet and my hips to all be lined up and staying forward. What a lot of people will do is they'll start with this foot more externally rotated. And this is kind of a strategy your body is using to try to take some tension out of that hip flexor group, particularly out of that iliopsoas group, creating some external rotation to create some slack. So we don't necessarily need that foot to be perfectly straight, but we want it to be in that normal kind of gait stance, which would usually be anywhere from that 5 to 10 degrees of external rotation. We want to make sure it's not twisted way out this way. The other fault that people will often make that we want to watch out for is that they're going to want to kind of create a bend through the knee. And again, this is a strategy to limit or avoid extension through the hip itself. Here, if we're doing this, we're translating through the knee itself. But if that knee is bending, it's not allowing the thigh to go posterior. So we want to make sure that we're keeping the thigh straight and lunging forward to make sure we're creating an extension, as opposed to if you bend that knee, it pulls the thigh forward to take the pressure off and the focus off of that hip flexor group and off of the hip itself.